Lizzie. I'm going to be your nurse today. Can you confirm your name and date of birth for me?
Charlie Brown, 11/25/59.
Okay, just going to take a look at your armband here. Awesome, thank you. All right, and do you have any allergies at all?
No, ma'am.
No? Okay, very good. All right, well, what I'm here today, I'm just going to do a physical assessment on you, just kind of listening heart, lungs, sounds, kind of look out at your skin and everything. And so we'll get started with that. And I did clean my equipment ahead of time, so I'll be using that, and then we'll clean at the end and everything as well. All right, so you already gave me your name, so I know you're oriented to person. Can you tell me where are you at today?
Temple College.
Okay, what are you here for to do?
A physical assessment.
Okay, and you know the dates today?
Yes, December 3rd, 2024.
Okay, very good. So patient is oriented ×4 and alert, and just looking over your general extremities. You're gonna hold your arms out, hold your legs out a little bit. Thank you. All right, so patient appears to be symmetrical, and just taking a look at the skin and everything here as well. Back to that other part. So symmetrical, and she's dressed according to the weather, appropriate for the weather and everything. Calm, cooperative, answering questions. Skin is warm and dry, no lesions or abnormalities noted throughout. And so I'm going to go ahead and check out your eyes here. So I'm just going to shine a pen light in your eye. If you can just kind of put your fingers there, your hand there, thank you. I'm just going to shine this here. I'm going to look, see if it's constricting, which it is. Okay, thank you. So pupils started at a 3, went down to a 2, returned to a 3. They are round, reactive to light, and then if you can go ahead and pull your lower eyelids down, there we go. All right, so the conjunctiva is pink and moist, and the sclera is white. While I have the pen light, I'm gonna have you kind of turn your head just a little bit and look in your ears. Do you have any hearing loss or any hearing aids or anything?
No, ma'am.
No, okay. And tilt your head back just a little bit for me, thank you. I'm gonna shine a light here in your nose. No drainage noted there either. I'm going to take a look in your mouth, so just kind of checking teeth and everything. I'm just going to use a tongue blade just to kind of move the gums to the side and everything there too. All right, so I'm going to open up your mouth. Thank you. Okay, just kind of looking at the gums there. All right, thank you. Then you can smile. All right, excellent. Thank you. All right, so teeth are white and straight. They're in the proper position. No missing teeth noted. And the gums and oral mucosa are pink and moist. No lesions or abnormalities noted there. Okay, and now I'm going to go ahead and listen to your heart and lung sounds. So if you don't mind just kind of pulling your gown down just a little bit. Thank you. So I'm going to start out with the heart sounds. And so first off, we have the aortic here on the right side of the chest, about at the second intercostal space to the left, to the right of the sternal border. So that's aortic. And then moving over here, just across the way, is the pulmonic valve. And that one's also at the second intercostal space to the left of the sternal border. And then next, if you're going to lift up your breast just a little bit there, I'm going to go ahead and go to your tricuspid, which is about at the fourth intercostal space to the left of the sternal border, next to the mitral. So perfect, thank you. So out at the fifth intercostal space, at the left mid-clavicular line. Okay, and I would listen there for a full minute. Excellent, thank you. Now I'm going to go ahead and listen to your lung sounds. Start here in the front. Okay, Now listen for a full inhalation and exhalation at each spot. Okay, so just take a deep breath in at each place. Okay, so 4 spots in the anterior. I'm going to go ahead and move to the posterior and lateral. I'm going to start out with the lateral. Okay, and then to the posterior. And again, full inhalation, full exhalation. Okay, 4 spots in the back. Okay, and while you're leaning forward, I'm actually going to take a look, just check for any edema in the buttocks, and just press gently. Okay, no edema there, so it looks good. And you can go ahead and pull your shirt back up and everything. Thank you. All right, so I'm going to go ahead and move on to the abdomen, so if you don't mind just pulling the gown up one more time, thank you. I'm just going to inspect the abdomen first off. So abdomen appears flat, no distensions, and no abnormalities, no scars, feeding tubes, ostomies, or anything there. And now I'm going to listen, starting with the right lower quadrant. Right upper quadrant, left upper quadrant, and left lower quadrant. Okay, and at each spot, I'm just listening for any gurgles, and that is normoactive. You can go ahead and put it back down. Thank you. While we're on that topic, do you know the last time that you had a bowel movement?
Yesterday.
Okay. Any issues, any pain, or anything with that? No? Okay. Color, just normal brown, or?
Mm-hmm.
Okay, excellent. And when was the last time you urinated?
About an hour ago.
Okay. Any issues, any pain with that? No? Okay. Color, what do you say? Is it just yellow?
Mm-hmm.
Okay, excellent. Was it clear, cloudy? What would you say?
Clear.
Okay, very good. All right. Well, I'm going to go ahead and move on to your arms here. And so I'm going to check your pulses, the radial pulses, and feels great. Strong and equal bilaterally. And then I'm going to check your capillary refill. Okay, and it's great, returns within 3 seconds. Now I'm going to go ahead and have you squeeze my hands. Perfect, thank you. Push against me, okay, and then pull. Excellent, thank you. All right, so I'm going to go ahead and do your, assess your legs as well. Have you had any numbness, tingling, or anything in your legs?
No.
Okay, what about anywhere else in your body? No? Okay, very good. So I'm just going to take a look there, check to see if there's any edema or anything there in the lower legs as well. Okay, you can stretch your legs out a little bit. Thank you. Okay, just checking over the tibia there. No edema noted, so that's a 0. And now I'm going to go ahead and check your pulses, pedal pulses. Okay, pedal pulses are strong and equal bilaterally. And if you don't mind just slipping your shoes out, thank you. Okay, check your capillary refill here as well. Toes, and they're less than 3 seconds. Very good. Last thing, I'm going to have you pull up against my hands. Perfect. And then push down like a pedal. Awesome. Thank you so much. You're good. You can go ahead and put your shoes back on. Thank you. All right. Well, I'm just about finished. I'm just going to clean my equipment off here, and then we'll be good to go. Do you have any questions, anything right now?
No, ma'am.
Okay. Very good. All right, well, I'm just going to step out here, but if you need anything while I'm out, just press the red button there on your call light. Thank you.